everyone, I'm Sondra Smith. I'm the Chief Strategy Officer for Hilton Regional Healthcare, and we're here again to talk with you on Getting Candid on COVID-19. We're so excited to have Jeremy Clark, the CEO of Hilton Head Regional Healthcare, here with us. And today, Jeremy, we'd like to hear a little bit more about what's going on inside the walls of the hospital to prepare.
Okay. Well, one of the things we're doing is really focusing on our resources. And right now, I really feel like we have an adequate amount of resources. We're doing that in a couple ways. As you and I have discussed, we have changed our visitor policy and to really limit that to no visitors. The main reason we did that was to protect our other patients, our staff, our physicians, but we also did it because it helps us conserve the resources we have. Again, I feel like we're adequately supplied today, but we also need to manage that in a safe and conservative manner so that we are prepared for tomorrow as well.
So that's part of preparing for the future.
Absolutely. We're currently working with all of our existing suppliers, but we're also finding new and alternative suppliers that can help us during these really unprecedented times.
Okay. Could you tell us a little bit about your team, the folks you're connecting with every day to really stay on top of things?
Right. Yeah, we have a great team. We have our incident command center that we meet every day. We're very fortunate that we have some really well-trained individuals in this health system who have provided great counsel to me as we've gone through this. We drill for situations like this. We've had some other emergencies that we've used lessons learned from those to help plan for this. So I feel really good about the work that the team is doing and helping us develop those plans for the future, especially given the fluid nature of this situation.
Right. And do you use that team to communicate with DHEC and the CDC that you've referred to before? Or?
Yeah, we've been in constant communication with DHEC. They have an outstanding website. They and the CDC are really the experts in this, and so really we are using those two sites as the sources of truth for the information that we're basing our plans on.
Okay. And there's been a lot of talk or concern about whether or not you're preparing for a future surge. You said you feel prepared right now. What are you doing to prepare for the future?
Great. It's a great question again. I feel really good about where we are today, but we're using today and tomorrow to really prepare for the future. What if the situation develops, and what if we see a surge of patients? So we're doing a couple of things. One of the first things we're doing is really expanding our capacity. And one of the ways that we do that is by lowering our census. So right now, we've significantly taken down our census. We have canceled all elective surgeries and other procedures. We've limited our visitors, as we've discussed, but we're also limiting our services. And this helps us conserve the resources that we have. By far, our best resource is our people, the outstanding colleagues and physicians that make up our organization. And we're working with them in a different way as well. One way is that we've created a labor pool so that for people who are not doing jobs that they used to be doing, we could retrain them and use them in areas that we may need them in the future. Okay. And so, for example, a surgical technician who may not be doing a lot of cases in the OR right now is being used to help screen patients in the ER. Or some of our operating room nurses are being retrained to work in other areas as well. So we're fortunate that we have really intelligent, really capable people that are able to be retrained and kind of redeployed in a moment's notice. We're looking to do the same things with our medical staff. We know that there are a lot of physicians out there who have incredible skill sets who may not be practicing in their traditional specialty over the next few weeks. So we're looking to see how can we work with them to help provide care where they're needed.
So it sounds like a lot of it's about flexibility, just understanding your resources and finding ways to use it for the future.
Absolutely. I mean, this is a fluid situation, and that's why I feel really good about the plans that we have in place today, but also the plans and the contingency plans that we have available as we move forward in this.
Very good. Well, thank you so much for sharing that with us. We look forward to talking with you more to get candid about COVID-19. Tune in for our future episodes.